I'm joined on this call by several of my colleagues here, but I want to call out Sealy Caleppo as someone that will be able to help mitigate some questions in the chat box. Feel free to direct message him or put your questions in the main chat or reach out to me privately as well. We have somewhat of a packed agenda, but before we kind of get started, I do want to talk about the interpretation that we have available on this call. We have Spanish, Somali, and ASL interpretation. We just asked folks that you please enter the English room at the start of this meeting. You'll notice on the bottom of your screen, if you're on a desktop, you'll see what looks like a globe. If you could please just click that globe and select English. That way we can hear the interpreters communicate with us as if they have any questions that are in Spanish or Somali. And while you're all doing that, I would like to invite Maria in the Spanish interpretation room to come into the English channel and just let folks know how to find you or how to find her if they're looking to hear this in Spanish. So Maria, if you could let folks know.
Buenas tardes, habla la intérprete de español. Por favor, si necesitan interpretación en español, busquen el icono del globo que les aparece en la parte de abajo de la pantalla, hacen clic ahí y seleccionan español como el idioma para escuchar esta reunión. Si tienen alguna pregunta, también la pueden poner en el chat.
Gracias, Maria. And now I would like to invite someone from the Somali interpretation room, either Haji or Mashida, to let folks know how to find you.
Right. So kusoo dhawaada maanta shilkeena aan maanta meesha aan ku qabanayno haddii oo u baahanta luqadda Soomaali oo turjumaanka meesha qaaradda hoos taawo kadibna waxaa arkaysaa luqadda oo Soomaali dooro luqaddaasiti si wax walba oo ku dhagaysato oona lagu turjumaano Ingiriiska to Soomaaliga. Waa ku mahadsantay.
Hey, thank you, my friend. All right. So we're going to get this meeting started here. I would like to call on a colleague of mine, Giselle Zapata, to come in. They're going to do a little presentation for us. Giselle wears many hats here in the county, but maybe I'll let you, Giselle, introduce yourself and let folks know what we're going to be talking about. Thank you for joining us.
And thank you for having me. Hello, everyone. I appreciate you guys joining us today. I am going to actually be sharing my screen, but what we're going to be chatting about for a little bit are some updates on the expanded health coverage for immigrants that have previously not been eligible to obtain health coverage through the Washington Health Plan Finder. So let me I'll share my screen, and then I'm also going to be sharing with you all that I'm part of the Access and Outreach team under Daphne Pai, who you see here on this very first slide. We're part of a team of over 20 certified health insurance navigators, and we actually assist with a variety of different social services programs in terms of eligibility and application assistance. We'll be giving you an overview of all that towards the latter part of this presentation. So we have already started open enrollment, and that's something that happens every year on November 1st. And this year it will end on January 15th of 2024. If you would like further information, you're welcome to reach out to me or my boss, Daphne Pai, who's the Regional Health Services Administrator for our team in the Access and Outreach Department. So talking about open enrollment, basically it is something that began during the healthcare reform when the Affordable Care Act went into place, otherwise known as the ACA. And one of the things that happened at the time was that it was agreed that anyone who was lawfully present or a U.S. citizen could be eligible to enroll in a qualified health plan, as well as receive Apple Health coverage for those who are eligible. Now, very particularly, undocumented residents were not considered lawfully present, so they were not able to enroll into a qualified health plan or purchase a plan, basically because of their immigration status. So lawfully present basically means you're a U.S. citizen by birth, by I am so sorry that I'm blanking because I'm actually one myself. When you get naturalized, as a naturalized US citizen, when you're an immigrant who comes to this country and then becomes naturalized. And then we have folks that are actually nationals. And then we have folks that are here with a green card and have legal permanent status. And so those folks are able to purchase a health plan through the Washington Health Plan Finder and have been eligible as well for Apple Health as long as they meet all of the criteria. So what's new this time around? Thanks to a lot of advocacy of many different groups for the past few years, we are able to, here in the state of Washington, eliminate the lawfully present status of the Affordable Care Act. So we have the ability for folks, no matter what your immigration status is, to be able to purchase a qualified health plan, otherwise known as a QHP, as well as a qualified dental plan. In order to purchase a qualified dental plan, you do have to first purchase a qualified health plan so that you can have both medical and dental if you so choose. And enrollment again opened up on November 1st because this is open enrollment for health coverage in 2024. Basically, anybody that enrolls in a health plan from November 1st through December 15th, their coverage will actually start on January 1st, 2024. If they wait after December 15th, so basically December 16th through January 15th, when open enrollment ends, their coverage will begin on February 1st. So the individuals that are actually US citizens and have a lawfully present status are able to receive federal financial assistance. They receive tax credits. So the unfortunate part of this is that at this time, this is a statewide ability for folks who are undocumented to purchase a plan, so they are not eligible for federal assistance. They are, though, if they're under a certain income of the federal poverty level, eligible for a state assistance that we're going to talk about in a little bit in a future slide. One thing to note is that international students and individuals with visitor visas are not eligible for this new coverage. So here we have some information that we wanted to share with you all. So basically this 1332 waiver is what allows our folks that had previously not been able to purchase health coverage through the Washington Health Plan Finder to now be able to purchase it. So basically what we're looking at here, if we look at the chart, we've got that breakdown by federal poverty level. If you look at it, it's pretty big chunk that are fairly low income. So there's going to be a lot of folks that are currently uninsured and have an immigration status that is not considered lawfully present that will now be able to purchase a health plan through the Washington Health Plan Finder, thanks to this 1332 waiver that was approved. And throughout this,
sorry to interrupt you. Would we be able to slow down just a tad, just for the interpretation or interpreters?
Yes.
Thank you so much.
Absolutely. No problem. Thank you. So here we wanted to share with you all the whole state has a lot of folks that are going to be in this group. However, as you can see, a larger chunk of this population are in King County, as well as a few other larger counties. So we've got a lot of work ahead of us to make sure that these folks have an opportunity to learn about what this means to them and how it can make a difference. Now, one of the things to keep in mind is that there's a two-step process for this. We have just started the expansion enrollment period, which is November 1st through January 15th. So once again, if folks sign up in between November 1st and December 15th, their coverage will begin in January. If they apply from December 16th to January 1st, their coverage will start on February 1st. Now, this is a coverage that is not free. they would have to purchase a plan, and they have the option of purchasing medical and dental. So qualified health plan is for medical coverage, and qualified dental plan is for dental coverage. You can choose to only purchase medical alone without dental. That is up to the individual. But if they really want dental, they have to also pay for a qualified health plan as well. So that is one thing to note, that this expansion is of something that already existed in the Washington Health Plan Finder. The only difference is that there are groups of immigrants that were not allowed in the past to purchase a plan will now be able to, effective November 1st, when we've opened up for open enrollment, but they won't be eligible for federal tax credits. Now, the second step of this expansion is related very specifically to Apple Health. And this one goes into effect on July 1st of 2024. And it's really for those adults who are not pregnant who meet the income guidelines. So they have to be under 138% of the federal poverty level. So there are individuals who are currently going to be eligible in that group, but this program does not become available to them until July 1st. Right now, as it exists, we have Apple Health for undocumented children up until the month in which they turn 19 years old. And we have a program for pregnant women who are undocumented. So really what we're looking at here will be for adults that are 19 years and older who are not pregnant that meet that 138% of the federal poverty level. So one thing to keep in mind is that we do have much appreciation for this program. However, not enough funding was approved for it. So we're going to talk a little bit about how that's going to go in the next few months. So one thing to keep in mind is a qualified health plan really covers a lot of the basic needs. So before the healthcare reform, there used to be pre-existing conditions that a health insurance company could deny either to cover you or to cover that particular condition. The Affordable Care Act did away with that. So we don't have to worry about that at all. The coverage that everyone receives with their qualified health plan includes your basic doctor visits, hospital, all maternity, pediatric, newborn care, prescriptions, preventative care, especially for cancer screenings, all your vaccines, management of chronic conditions, and even mental health services. So it is very complete and really thorough coverage. So for 2024, the 9 insurance companies that are currently in the Washington Health Plan Finder that are providing many health plan options within their insurance company are these particular 9 that are on the screen. So we have Bridgespan, Premera Blue Cross, LifeWise, Kaiser, Molina, Regents, Community Health Plan, United, and Coordinated Care. And we're going to talk a little bit more in depth in the next few slides what exactly that means in terms of plan options within these 9 companies, because as you can see, 82 is a lot of options. And then there are 6 dental plans that are being made available here in our county. So the way this works within the Washington Health Plan Finder is that there are different levels of coverage that you can choose from. So bronze level will always be the lowest premium, but that then means that you're going to have a higher cost sharing of expenses. So per month, you're going to find it cheaper, but then when you need to use it, there's going to be more out of pocket that you have to put into your care as you receive services. The silver level is often the one that is recommended because it might be a little bit more costly, but then out of pocket is a little bit less as you're using the coverage. So it has a really nice balance to it. And then the plans that are gold level are usually the more expensive monthly premiums, but then as you're using it, you have less cost sharing or out of pocket. So something to note, because as we talk about the program that's going to provide some assistance with monthly premiums, those are going to be the silver and the gold level that you can select from. So here we look at what the Cascade Care logo is. So when folks are going into the Washington Health Plan Finder, whether it be on their own or with a certified health insurance navigator, they're going to receive many options with all those 9 insurance companies that you saw on the other slide. And within those companies, each of them have different levels of plan options based on the bronze, silver, or gold. So what we can let folks know at this point is that the individuals that in the past were not able to purchase a plan because of their immigration status will now be able to purchase, but they may need some assistance with their monthly premiums. So in the past, everybody who's a U.S. citizen or lawfully present, they get those federal tax credits and Cascade Care savings. For our folks that are joining us in this ability to be able to purchase a plan, they will be eligible as long as they make up to 250% of the federal poverty level or less to receive a $250 per person per month credit towards their monthly premium. They do have to, as they're looking at their options, keep an eye out for this logo that you see on the screen for Cascade Care. Very, very important. And they also need to keep track of the levels. So there's going to be that silver and gold level that they'll need to pay attention to. It can feel a little bit complicated, so that's why I really strongly recommend that folks reach out to one of the certified health insurance navigators so that they can walk them through that. Now, here's the income guidelines for the 250% of the federal poverty level. So as an example, let's say there's a family of 3 and you've got your child on Apple Health. Let's say mom is pregnant, she's on pregnancy medical, and dad is the only one who is uninsured. So for a family of 3, as long as their annual income is less than $62,150 or per month $5,179, then that father would actually be eligible to purchase a health plan with that Cascade Care savings of $250 per month applied towards his monthly premium, as long as he remains under that 250% of the poverty level. So it definitely gives folks some ability to receive assistance with their monthly premium. Now, another thing that we are finding is that folks, because they haven't been either on insurance in the past, or maybe they come from a country where the health system doesn't work this way. Some of the language that folks have to learn along the way are things like having to pay a monthly premium or co-pays for your visits, or co-insurance, which means, you know, you share a part of the cost of your healthcare service before you have to complete your deductible or meet your deductible. And then even deductible. Now, the one thing about deductible, I have to say that oftentimes, because here in the state of Washington, we have to have car insurance, folks for the most part understand the word deductible when you reference car insurance. It's the other pieces that get a little bit more tricky, you know, when we're talking co-insurance, co-payments, out-of-pocket maximum. So once again, I keep coming back to the fact that I think it's really valuable to reach out to a certified health insurance navigator. So one of the things that we wanted to share would be an example. Now, please keep in mind, every individual is going to be different. So in this particular example, we have, say, a 36-year-old female who's undocumented, lives in Federal Way. She makes $1,600 a month. And the plan that she selects is Community Health Plan of Washington Cascade. There's that Cascade. Select Silver, so that's silver level. So the Washington Health Plan Finder will indicate to her your premium is $380.14 per month, but because of your income and family size, you are eligible for that Cascade Care savings. So then it applies that $250 reduction. So then the individual would be paying $130.14 per month to have her health insurance as Community Health Plan of Washington Cascade Select Silver. Her annual deductible would be $2,500. Her co-pays for primary care and doctor visits would be $30. Generic drugs was $25. Urgent care visits, $65. Lab tests done in outpatient are $40. And then x-rays, you basically pay up to your deductible, and after that, 30% of the cost of care is out of pocket. So one of the things to keep in mind is that all of this is it can feel very complex. And so I want to really drive that message home, that this information is very confusing to folks who have never had to purchase a health insurance plan. So it's really helpful to them to understand how this works, what it might cost them. And in the end, they need to decide for themselves whether this is the right decision for them. We had a gentleman a few months ago before open enrollment he's in his 40s, lives in King County, was just diagnosed with multiple sclerosis and has many doctor visits, a lot of testing to go through, thousands of dollars in medication every month. So he was, practically in tears, waiting for this opportunity to be able to get a health plan that will cover him and help with some of those costs. So it's definitely going to be case by case in terms of what makes sense for that individual. There's going to be, the reality of trying to understand the system and then figuring out whether it makes sense for you and which option, because there's so many. So then we also have, as I mentioned, in July, we will open up Apple Health for non-pregnant adults. The beauty of this is that these are the lowest income individuals. So they're going to be under 138% of the federal poverty level. They don't have to pay any premiums. There's no co-pays, no co-insurance, no deductibles. But as I mentioned a little while ago, the problem is we don't have enough funding to cover everybody. So what we have been told by the state that there's going to be some ability to get folks on. I'm going to share really quickly here, once again, a family of 3 example. So if they make under $28.59 per month, then the adults could receive that free Apple Health for Adults program, or $34,307 per year. Please keep in mind that this is what those income guidelines are today, but they will be updated in April as they are every single year. So the Washington Health Benefit Exchange and the Healthcare Authority have said up to today that what will happen is for folks who enroll now for coverage, if they are under 138% of the federal poverty level and they're not lawfully present, then they would automatically get those first slots for Apple Health on July 1st. They will be automatically moved over. So basically, those individuals are only paying those monthly premiums from January or February through June. And then they switch over and they take those first slots. Keep in mind that there aren't enough for everybody. So we're really wanting to drive that message home to folks that if there's any way for them to try to get those monthly premiums paid for, because they have to keep up with them, they can't lose their coverage, then it will benefit them because they will be automatically enrolled in Apple Health in July and no longer have to pay anything out of pocket. So one of the other things that they said is that they will, the Healthcare Authority and the Washington Health Benefit Exchange, they do plan to reach out to folks who are under 138% of the federal poverty level, but they maybe did not enroll in a qualified health plan. So we have yet to see how that will roll out, but that is something else that they plan to do as well. Another question we have received is around the folks that have their legal permanent resident card, otherwise known as a green card. Folks who have not had their green card for 5 years yet are actually not eligible to obtain this new Apple Health program for non-pregnant adults in July. So this is not something that they will be able to obtain. They are, however, able to purchase a plan, and they can receive those federal tax credits as well, which really helps reduce that monthly health insurance premium per month. So we do have this frequently asked questions document that I will make sure to have Justin also share out with the slides. So some of these questions we have discussed, but I wanted to just highlight a few. Definitely, folks' information is safe in the Washington Health Plan Finder. There are federal and state laws that protect the privacy of folks, so there's no need to worry about that. There's also no chance that accepting any assistance through the Cascade Care Savings Program or the Apple Health program will affect individuals' immigration status or their ability to get their green card. So no public charge to have to worry about here. We really want to try to encourage folks to think about preventative care and how that really protects them from having a chronic condition or some other medical condition that really, if it would have been caught earlier through preventative care, can have them avoid a lot more advanced conditions in the end. So really important to get that message out to folks. And then that we do have that Cascade Care savings for folks who are 250% or less. So I did want to, Justin, is it okay that I answer the question in the chat, or do you want me to wait till the end?
No, yeah, you can definitely answer it. I'll read it out loud for folks as well. The question is, can people with green card purchase the qualified health plan? And can you clarify?
Yes, anyone with a green card or legal permanent resident card can purchase a qualified health plan in the Washington Health Plan Finder. Absolutely. And they're able to receive those federal tax credits as well as Cascade savings if they're eligible. It will depend on their family size and income. Okay. Hopefully that I've answered your question. If not, please let me know. Thank you. I also want to make sure that everybody's aware that we do have our access and outreach team services through our CHAP line at the 1-800-756-5437. You're also welcome to email us at chap@kingcounty.gov. We invite folks to check out our webpage at kingcounty.gov /outreach. And the beauty of our staff is that we actually are the lead navigator organization for King County and a couple other counties, and that's within the network of health insurance navigators that are certified by the Washington Health Benefit Exchange to assist folks to obtain health insurance through the Washington Health Plan Finder. For our services, we do a lot more than that. Because we're a lead organization, we are also providing technical support to certified navigators that are within the network. So they might be housed at, say, a community-based organization, or maybe one of the federally qualified health centers, community clinics, that kind of thing. However, we do like to share that the Washington Health Plan Finder is open and available to anyone to explore and apply through. So the link here on the screen at wahealthplanfinder.org is definitely good to know. And then our team assists with more than just health insurance. So we're able to assist with all of the DSHS programs, including classic Medicaid, basic food, child care assistance. These programs that are under DSHS, we know the eligibility criteria and can assist you with the application. There's also energy assistance programs through the city of Seattle and through other organizations. And so we're able to let you know if you're eligible for that and assist you with the application. We actually also give out ORCA cards and can help approve folks that are eligible for the subsidized annual pass as well. And then we have a couple of different programs here, such as the breast, cervical, colon health program, the Access to Baby Child Dentistry program, and King County Adult Dental Program. All of these have different eligibility criteria and services that are provided. So we're more than happy to assist folks to understand what else outside of health insurance might you be eligible for, and then assist you through that process as well. So it's a very complete type of service that we're able to offer through our 1-800 line or in person. So I did want to point out that we have oh, I'm so sorry, Justin, I just saw there's another question in the chat.
Yeah, the
go
question is about are these documents translated into different languages? It just can help with awareness, as this is kind of a complicated process.
Yes. Which documents were you referring to, Almaz Ashiti?
Thank you. I'm referring to those who leads us how to access all the processes and the different kind of insurances.
So perhaps I think maybe just the PowerPoint that we went over and the step-by-step guide of how to access health insurance, if I'm understanding Almaz correctly.
Yeah, that's what I meant. Thank you.
Okay. Thank you. So we do have some of the documents are available in a few languages. Very specifically, the services that we provide at Community Health Access Program, that brochure is only in English and Spanish, but there are other languages for some of the flyers around the expansion of the health insurance. I believe we've got those in English, Spanish, Somali, Amharic, Korean, maybe Vietnamese and Chinese. So I can go back, Justin, and find those and just include those with all the documents to you so that you can share out. Does that sound okay?
Yeah, thank you so much.
Okay, thank you.
It's just
Appreciate it. So these programs listed here on this page are already in existence. They've been around for a long time. So I just wanted to make sure everybody is aware that these programs, Apple Health for adults, Apple Health for kids with premium, for pregnancy, Alien Emergency Medical, and family planning, all of those currently exist. So if anyone is eligible for any of these programs, we are more than happy to walk them through that, let them know what the eligibility criteria is, and assist them with the application process. So we can do that either in person at one of our 2 storefronts, either in downtown Seattle or in Federal Way. We also are located at over 30 outreach locations. So that could be at a school, at a college, at a library, where we might go once or twice a month, maybe a community-based organization. Definitely all of our public health clinics, we have them located in Bellevue at Eastgate. We have one in North Seattle. We have one in downtown Seattle, South Seattle and Columbia. We've got Kent, Renton. So there's different public health clinics. All of them have navigators that are certified, that are part of our access and outreach team, that are located at those locations. So folks can visit us in person if that is their preference, or they are welcome to call us at our 1-800 line for Community Health Access Program, known as CHAP, at 1-800-756-5437. I think I have another question for Marie Rose.
Yeah, the question is about getting translations in French, Lingala, Swahili, and Portuguese. And I know I can work with the language access department and maybe come up at least with a couple one-pagers and put that request in if you don't have those languages.
Perfect. Thank you so much. I'm going to check. I feel like we might have Portuguese, but I will double check and get back to you, Justin, so that way you can share out. Thank you so much.
Beautiful. Thanks.
Oops. And then I apologize. I just wanted to make sure to share that we are trying to see if there's any way that we can help with sponsoring premiums, especially for those in the lowest income. No decisions have been made yet, but that is something that we are trying to see if we can make happen. We do have a bunch of events where our certified health insurance navigators are at throughout the month. We are going to be sharing those here on these slides, and then we'll soon have the event calendar for December as well as for January. Our staff that work with the Breast Cervical Colon Health Program, known as BCCHP, and the King County Adult Dental Program, known as KCADP, are also making sure that all of our folks that are enrolled in these programs are aware of this new opportunity to obtain health insurance, because these programs that they're on, BCCHP and KCADP, are fabulous, but they're very specific and only for the services that they cover. So BCCHP covers PAPs and mammograms. KCADP only covers some basic dental care. So ideally, folks could have full medical and dental coverage through the Washington Health Plan Finder. And then even at our public health centers, our navigators are also making sure that they're letting folks know and assisting them through that process and answering their questions, helping them navigate this system and better understand so they can make a well-informed decision for themselves. And my boss just added to, please, let's make sure that we help get the word out for all of us that are working with community members that might be eligible, to please let them know that this is an option and that they should look into it. They're welcome to join us at any of these events. Our more than 20 staff speak a variety of languages. So we've got Spanish speakers, Somali speakers, Amharic, Vietnamese, Chinese, Korean, and we use Language Line for all the other languages, but there are a lot of different locations to visit us at, or maybe if they prefer to go to one of our public health clinics, they're welcome to do that, or one of our storefronts in Federal Way or Seattle. And I think that's it. And I apologize, I may have gone over my time just a little bit. Thank you.
Yeah, it is okay, Giselle. Thank you so much. And I do just want to uplift Giselle's team, and can't stress enough that in this new expansion program, working with a community health navigator can help really bridge the gap with digital access and digital literacy. This is a daunting task for some, and if you need a resource, Giselle's team is out there, because that digital literacy part can be overwhelming at times. So we will send all the contact information that Giselle spoke of today in a follow-up bulletin. And the two questions that I had as direct questions, you kind of touched upon, but to bring to our attention again, it is around, your information, especially for folks who are undocumented. Will my information leak? Is it safe? Signing up for this program. And as Giselle said, your information is protected. It will be protected. So that is something that, they've thought about. But that's all the questions that I have gotten. Maybe we'll open it up for a quick minute here, see if there are any other folks that have some questions for Giselle.
Looks like it's crystal clear. Yay.
Yeah.
Thank you so much. And I hope you don't mind, Justin, if I just hang out for the rest of the meeting. I usually like to join when I can. So thank you guys very much.
Thank you, Giselle. I'm just going to pivot to a PowerPoint here. Just give me one sec. Where's my share the screen? All right. Did that work? All right, I think we are good to go. We're just going to go over a couple quick things here around, the world of COVID and our new vaccines. So as you all know, we have a new vaccine that came out almost about a month and a half ago. And it has been approved for everyone 6 months and older. It's called the updated COVID-19 vaccine. It is the one and only COVID vaccine that we are using now moving forward. This vaccine is especially important for older adults and people with high-risk conditions. At the start of this rollout, it was rather hard to find the vaccine. A lot of clinics, were pushing dates out till, January. I saw some even into February. But I will say now that most pharmacies in King County are completely stocked up. So it is easier than ever now to get that new COVID-19 vaccine. And to remind folks again, you can pair it with the flu vaccine as well. So a lot has changed in the past month since we talked, and that being one of them is that the stock is readily available. Let me just skip ahead here. So to find the new vaccines, we're letting folks know that they can go to vaccines.gov. So this is just a main landing page, and here you're going to put in your zip code, what vaccine you're looking for. It's going to ask for either Moderna or Pfizer, or feel free to check them both. So this one says that some pharmacies and clinics will have them in the coming days, but as I said, most folks do. What we're still seeing a little bit of a lag in when it comes down to the vaccine in small pharmacies is the vaccine for children. That is a little bit on a backlog. I know Kaiser specifically has vaccine for kids right now, but some pharmacies are still not able to have the new COVID vaccine for children. But for adults, most places will have that vaccine in stock. So you can get vaccinated in pharmacies, healthcare providers, community health centers. We have one in Kent, the Shower Center, a big event there where you can get the flu and the COVID-19 vaccine. So as a reminder, children and teens, anyone under the age of 19 has no cost when it comes down to the COVID-19 vaccine. There's different types of providers in the childhood vaccine program. which there's a link that we will send out in this follow-up, school-based health centers as well, and then also mobile vaccine clinics for children in South King County. When you click that link, you will see find a clinic, and it's going to show you some pop-up events centered around children and teens. When we talk about uninsured, and underinsured adults, you will be able to get that vaccine at no cost. A lot of places like CVS and Walgreens, they are offering something called the Bridge Access Program. So that is aimed at getting that no cost for individuals, again, who are uninsured or underinsured. Community health centers, Snoqualmie Valley Hospital and the Public Health Kent Vaccine Center all has that no cost for the uninsured and underinsured. The Bridge Access Program, when you go to vaccines.gov, is a little bit tricky. It's almost a 3-step process to find locations nearest you that offer that no-cost vaccine for folks who are uninsured. And I'll kind of walk you through that here. But when you go to vaccines.gov, you're going to put in your 5-digit zip code, so 98004. You're going to select the vaccines that you want, Moderna and Pfizer, or just Moderna or just Pfizer, and you will hit next. That's going to bring you to step 3. And on step 3 is when you're going to select the Bridge Access Program. Once you select that Bridge Access Program, it's going to list primarily all the CVSs and Walgreens, nearest to you. And then you will click on, let's just say you'll click on the CVS. And once there, it will bring you to the CVS landing page where then you can schedule your vaccine appointment at no cost. Okay, so cost around the new COVID-19 vaccine. So most insurances are going to pay for the whole cost. This includes Medicare and Medicaid, also known as Apple Health. You will get vaccinated by a provider in your insurance network. So vaccine locations will ask you if you have insurance. And if you do, please say yes. And, that will be covered by your insurance provider. The tricky one here is if for folks who have Kaiser. Kaiser is a little bit more restrictive. You want to go to a Kaiser location. Or I believe Bartell's also works closely with Kaiser to cover that cost. But if you have Kaiser and you try to go to a CVS, that's where you're going to run into a little bit of issues, and you're not going to be able to get that vaccine covered because it is out of network. Most other insurance providers outside of Kaiser, you can get the vaccine covered with your insurance plan in a lot of different locations. So just be a little bit cautious and make sure you're going to the right location so that you don't have to pay. And a reminder to folks who are 19 years and under will never have to pay for a COVID-19 vaccine. All right, we kind of went over this again, but just to stress it, you can get a free COVID-19 vaccine if you are uninsured or underinsured. Please use that Bridge Access Program, but just rest assured that CVS's and Walgreens, all in King County, are a part of this Bridge Access Program. So you could walk into a CVS or a Walgreens as a drop-in, let them know that you will want to access that Bridge Access Program, and you can get your COVID-19 vaccine there as well, kind of beating the vaccines.gov if you're near a location. All right, I know we're skipping a lot here. I'm just trying to be a little bit mindful of time. So help your body fight the new variants. We haven't heard of a new variant in a long time, but that doesn't mean they're not out there. It's the fall right now, and we've all had people close to us get sick. A lot of sore throats are going around there. So just be cautious as always. Know your body. Get the new vaccine. If it's been more than 2 months since your last COVID-19 vaccine, or it's been roughly around, 3 weeks to a month since you perhaps have gotten COVID. If you've had COVID recently, you still can get the new COVID-19 vaccine. It's just once you've recovered, and that's probably safe to say like a 3-week window. If you are a little bit unsure if it is safe for you to get the new vaccine, it's always good to reach out to your healthcare provider, your primary care doctor, and then both of you can, come up with a safe plan moving forward for yourselves. But definitely, I want to stress that this new vaccine is the only one out there. And another important thing too, not everyone has been vaccinated. So moving forward, or in the past, we had, you got your first dose, you got your second dose, and then we had various boosters that followed. Because this is the only vaccine moving forward, if you are new to the COVID-19 vaccine world, you will just get one shot. You don't have to do a first dose, a second dose. You will go and get one COVID-19 vaccine, and then you are up to date. So gone are the days of the first dose and the second dose, and you just have to do one. So that's that's great news for folks, who have families, can't take too much time off work. They don't have to recover twice with that first and second dose. So this is really aimed at, making sure that, you can reclaim the time and not be out as sick and not have to take off as much work. So keep that in mind when you are talking to people who are still a little bit hesitant that haven't been vaccinated, that it is a one and done type shot, and that is with Moderna and Pfizer. COVID. So I know we talked about this, but is it safe to get the COVID shot and the flu at the same time? It is. Again, it's going to come down to just understanding your body. For me, getting the flu shot kind of wipes me out a little bit versus the COVID-19 vaccine. So I got mine on separate days. If you want to, avoid separate appointments for vaccinations, definitely get them at the same time. If you feel that you can handle both, please do. If you want to separate it, that is all right as well. But they definitely can be taken at the same time. And it just eliminates, those multiple appointments. And then you can kind of, rest and know that you've been vaccinated for the flu and COVID. All right. So if you do have questions about the new COVID-19 vaccine, please don't hesitate to reach out to me. I'll throw my email in the chat box, but also we have some great landing pages here in King County. So kingcounty.gov/COVID/vaccine. And there you'll be able to find a lot of frequently asked questions and a lot of material, printed material, to hand out to you and your community as well. So I'll stop there before I kind of just branch away from COVID before we kind of wrap up. Does anyone have any questions, maybe about the new vaccine, or want to share a story of what they're hearing in community? Nope. Awesome. All right, I'm going to skip all the way to the end here. All right. So we are entering our cold weather season. The temperatures have drastically dropped here in the county and definitely in the nation. There's going to be more news to come on cold weather shelters, but this link here, which is from the Seattle Times, highlights a lot of them where you can find them in the city. There's a lot here in King County and a lot of good options in Snohomish County as well. When we share this slide, you'll have a full list of them. They talk about when they open, when they close, and overnight stays as well. So we're a little bit early, but the weather is definitely dropping. So more news to come in the bulletins in the next couple weeks. But I just wanted to highlight this. It is on a lot of people's minds as we enter, the holiday season and the cold weather. And then lastly, I do want to we talk about this a couple times, but when we talk about overdose prevention, Naloxone is now over the counter, and you can access the access to this medication is widely available. Primarily, fentanyl overdoses. You can get it in various ways, in person and by mail. I will personally say they will right to your door. This again is prevention for overdose, primarily for fentanyl. And we have a lot of great links on our website. And next meeting that we have, we're going to have the overdose team and prevention here to kind of talk about some of the statistics here in the county and some prevention methods moving forward as we talk about that crisis that we are facing. With that, though, team, very short and sweet COVID update with some other things sprinkled in. The majority of today was about the expansion of the healthcare plan. And I really appreciate Giselle being here for that. And I appreciate you all joining us.
Yes.
I do see something in the chat.
Yep.
Are there locations doing COVID PCR anymore? So testing. A lot of the testing is going to be at home COVID test kits, which you can get at majority of pharmacies. Also with the federal government, you can now get, I think, 4 or 5 boxes delivered to your house for at-home COVID testings. But doctors' offices, hospitals are still offering the COVID PCR test. It does come at a cost now. Most insurance companies will pay. For example, if you have Blue Cross and you go to, a doctor's office and get a COVID test, you probably will not have to pay for that test. If you stay in network, same as Kaiser. But gone are the days where you can go in to sites and get that COVID-19 PCR test and not pay out of pocket. It's all come down to privatization and insurances. So I don't know what location specifically, and I think this is a good follow-up for me to find out, but I do know doctors' offices and hospitals are still offering the COVID PCR test. Or if anyone else on the call knows, maybe if CVS and Walgreens are, that would be useful information. But I know your name says iPhone. I will find out, and I will include that in the bulletin where you can still get those COVID PCR tests. I just know that there is a cost attached to them now. Same as the at-home COVID test, there is a cost attached. It's just going to depend on your insurance provider. Is there any other questions before we kind of wrap up? Nope. Well, beautiful. I want to thank you all again for joining us. I want to thank our interpreters, our ASL, Somali, and Spanish. I know our Spanish interpreter was by themselves. So I really appreciate you, Maria, for stepping up and helping out. And moving forward, we will not be doing a meeting in December. We're taking that month off to have time with family and stay warm and all that jazz. But we will be releasing information via our bulletins and staying connected that way. So I do want to wish everyone a beautiful holiday season, a great, happy start to the new year. And we will see folks well rested and warm in the month of January. So thank you all for joining us, and I wish you all the best of your week. Have a good day, everyone.